Hi, my name is Jeffrey Becker. I am Chief Scientific Officer for Bexson Biomedical, and you are listening to Professionally Psychedelics.
Where do they go, the smoke rings I blow each night? Oh,
Hello, listener, and welcome back to the Professionally Psychedelics podcast. Today, I am really pleased to say that I am joined by a man with an enormous brain, but a normal-sized cranium. Joining us today is Dr. Jeffrey Becker, the Chief Scientific Officer of Bexson Biomedical. With a focus on neuropsychiatry and functional medicine and a footprint in this space spanning over 20 years, Jeffrey brings mountains of knowledge and experience to the pod today. With all this in mind and a brain that needs picking, all that's left to say is Jeff. Welcome to the Professionally Psychedelics podcast.
Thank you, Jonathan. That's quite an intro. Appreciate that.
Not a problem at all. And Jeff, as you'll know, our first and customary question on the pod is, what led you to the plant, or perhaps in your case, plant medicines?
Well, that's a big question, and it probably requires that I step back a touch to what was happening before finding plant medicine, which was that I was experiencing in college a kind of diminution, a kind of dimming light in my own consciousness about an expanded sense of being. When I was younger, I had this kind of sense of being able to reach out and kind of touch the numinous, or whether it would be God or whatever that kind of the mystery. And I was finding that was harder and harder to be in touch with, probably when I was about 19. And it was painful. I remember feeling disturbed and quite puzzled by what was happening. I felt smaller in terms of my sense of the world and my place in the world. And somehow I was able to come into contact with some friends who, I was at Berkeley. It was pretty much around, and it was easy to access. Mm-hmm. And I was with some friends, and we decided to do this. We took some mushrooms, and it basically set me off for the rest of my life on a set of interests in terms of consciousness, scope of consciousness, what it means to be integrated across different levels of the brain and different levels of being. I ended up searching out answers at the university and ended up studying religious studies, going to the department to get answers, and became close with Houston Smith over those years as an undergrad. Took his mysticism class and ended up finding out that I was a mystic at heart, and mm-hmm. that's a particular orientation towards the spiritual that isn't for everybody, but there are a lot of mystics out there that don't know that that's what they are. And that was the beginning. Of course, there's been lots of adventures along the way, but I found them to be very healing, psychedelics to be very healing to me, and also at times very painful. Making sense of difficult experiences, I think, has always been a puzzle, but I don't wish that I haven't had them. I always find that if you can work through the material, it can be extremely important.
How would you best describe the characteristics of a mystic? And you mentioned that you spent a lot of time seeking answers. Were you able to find them at that time, or did a lack of answers at that moment inspire your future professional journey that you went on?
That's a great question. The double parts there. I did feel that I found answers that were helpful to me in undergraduate study, and that informed my studies later when I dived more deeply into the science, neuroscience. What was extremely helpful to me was understanding that transcendence is something that has been happening to human beings forever, since we've been able to describe what it's like to be here on this earth. And so being able to plug into, multi-millennia descriptions of what it means to kind of have the ego dissolve and to kind of move into a higher level and then to return back to this world was very helpful to understanding what it's like when, when one's in a psychedelic state, of course, but if that also happens to one spontaneously, to know that that's also something that is a natural occurrence. It's not weird or strange. In fact, it's actually kind of something that can be quite powerful if you know what to do with it. It's also, something that feels like it's on the edge of psychosis as well, depending on the person. So I think it's very helpful to have a sense of paradigms, to know how to constellate what that is. And that's helpful at a personal level. It's helpful also when studying neuroscience, because science can be reductive as well. And that same reductive process that I was feeling myself falling into in college is something that I think we all have to engage in order to understand and structure what we see, what we hear, what we know. But at the same time, it's also in the service of something larger. And so to be aware of those two layers and always to understand that you, in the best of circumstances, have a foot in both sides of that line, so that you can kind of walk down the middle and use those tools properly, but not also get lost and believe that the tool and the process is the end all in the end. So a little complicated to explain, but I felt like my journey of study, started at the top in terms of the spiritual and moved deeper and deeper into the more specific and the molecular over the years, which in some ways is kind of the opposite of the way it normally happens, I think.
And you touched upon ego there, and that's certainly something that I want us to get to a little bit later on. But a question I have for you at the moment, and that is sort of at what point in your journey did your curiosity as a mystic and your professional background and vocation converge pertaining to work around psychedelic and psychedelic compounds? And at that point, what compounds were you sort of researching, and how has this changed and evolved over time?
Well, I went to medical school in order to understand better how to help with healing. Healing oneself, healing one's community, healing patients, understanding what the mechanisms are that we can apply to help people relieve suffering, essentially. And I was interested in the mind and brain. And so I ended up moving towards psychiatry. A lot of my heroes were oriented this way generally. A lot of the early secular humanism that I found meaningful was written by MDs and with backgrounds in psychiatry and psychology. And so that's the direction I went. And I do, it's funny to me now that I thought at the time I had a bit of a naive sense that we were going to become kind of magicians through the process with the use of medicines as our elixirs and potions, and to help patients to achieve release from pain and things like that. Yeah. I found out that was really not what medication offered. I think that I'll take a step back and say I do think that psychiatry can be very excellent at resolving acute pain and basically calming systems down to allow there to be time to make decisions and healing. And I think we're pretty good at acute intervention, and medications can be extremely important in that circumstance. I think what we're not good at is helping patients orient towards the long-term solutions that can help them not fall back into those same patterns that caused the pain to begin with. And medications, long-term use of medications is problematic at many levels. I mean, we don't have to get into that at any deep level, but the evidence is overwhelming that we change brain chemistry when we use medications for long haul, and that we probably really clearly don't know enough about what we're doing to people's brains with these medications. But that said, there are lots of people that need to be probably on something, and being on the right thing at the right dose and the right combination, I think, is a real art form. It's best informed, I think, by a very good understanding, a very strong understanding of neurochemistry and receptor science, as well as understanding kind of the arc of a human psychological development, and that pain sometimes is not something that we should be extinguishing if somebody is to move forward, that, the pain is actually a signal. There's hurt there, and there's guarding, and that guarding speaks to something. It speaks to something that needs to change or something that needs protection. So basically the gist of it is that I think we always have to think of our patients in terms of, multiple levels of their being. It's an overstated trope, but body, mind, and spirit always, of course. And as I moved into treating patients in psychiatry, I found that it was very necessary to be creative and look to other medications that might not have been thought of as useful, but also to look down at the molecular in terms of vitamins and minerals and plant molecules that can calm inflammation or improve gut tight junction integrity, things like that can reduce the load on the brain, free radical load and things like that. So that's going all the way down into the molecular. And then it's very necessary to be thinking about a person's long-term spiritual development and where they're going and whether they're making the right choices for themselves going forward, or whether we're just numbing pain that would actually cause them maybe to make the changes they need to grow and expand. So it's complicated. I am very excited about this shift in awareness of the medical community and the psychedelic community, and really the culture at large, that psychedelics have a role to play. They helped me heal. I've seen them heal other humans in my life. I've seen them heal other patients in my practice. But speaking to what they are and how they work and what the risks are and what the potential benefits are and all of that has been fraught with risk. And now it's really nice to be able to speak about this more clearly and with less fear.
I bet. And looking at your practice itself, what would you say predominantly are the psychedelics that you are using to assist in therapy with some of your patients and clients?
Well, I need to be clear. Let me state where I kind of live with my practice, which is that I don't work with psychedelics directly with patients at all. To be clear, I have not been certified through CIIS, and I'm not in the MAPS program, and that has been probably a specific choice on my part because of risk, and that I have a long journey ahead, and and I've come a long way, and I felt that what I was trying to achieve, there were only so many layers of risk that probably made sense for me to engage. So when I have worked with patients, it's much more in the context of just education. And I have a very specific way of talking about this with patients that I'll speak to right now, which is that I don't really feel that any given person can ever tell another person that they should do psychedelics. I think that they can tell that person about their own experience. They can point the way towards deeper education, point the way towards mature sources that they can read to understand it, point the way towards understanding what it can be like if it goes in the wrong direction, and how to manage that, and setting and all of these things that we all know. But I have always taken a step back and said, this is a serious decision that you need to make, and you need to know what your criteria are for going forward with it, and understand that not all psychedelics are the same, that they're very different in terms of the flavor and what they can kind of bring about, and the risks, and the time frames, and the intensity, and all of those kinds of things. So I lay all of that out. I really point people towards reading. I say, read, read, read. You wouldn't go to Europe without a guidebook. So don't even imagine that you're going to go into psychic outer space without reading ahead of time about where you're going and what the landscape looks like. And read, there's amazing, amazing resources from some of the finest minds that the world's ever produced. So what a rich process to engage and really try to get people engaged in that way. I don't know that has led to better outcomes, but I do believe it's a proper process for any given person to engage before they make the choice. I have seen the fallout of people being too quick or cavalier about jumping into the space without knowing enough, without knowing enough about what to do also in terms of accessing resources when a particularly difficult experience is had. So that said, I am not a guide in any kind of normal way that the community would say, but I am a teacher, I guess one might say. The other reason why I didn't go that direction is that I have been committed to understanding and using ketamine in the treatment of depression and in ketamine-assisted psychotherapy for a long time, for 15 years, and doing that right and being above board and being straightforward about it and developing that tool set really is required, I think, to some extent, for me at least, to not be distracted. And that's kind of how I got to where I am.
And Jeff, you mentioned earlier about sort of having a lasting impact and sort of lasting results and solutions that sometimes sort of traditional psychiatry and traditional medicine doesn't quite provide. Now, how significant would you say the role of consciousness is in the therapeutic journey, and knowing that this itself is very far removed from traditional medicine and treatments, how do you distill the importance of this to people, people in the general public, for example, or perhaps more pertinently, counterparts of yours, medical practitioners who may have spent decades living by sort of specific schools of thoughts and knowledge of sort of what medicine is, what treatment is?
When speaking with colleagues about how I approach things over the years, I have been surprised sometimes how different it is, how I think about the problem, what a kind of more integrated way of thinking about it in terms of, again, body, mind, and spirit, and trying not to be compartmentalized. To compartmentalize the decisions about what is going to be done, it's very important to understand what you're trying to do, what you're trying to achieve if you are giving somebody a set of nutrients after testing, and you've also done genetics, and you can see that their B12, for example, might be oxidized, and that might be why they're having trouble with methylation, even though their B12 is normal. These kinds of decisions are definitely scientific, and they're in a specific box. But one should always be thinking about not only how the B12 is interacting in the body, but also in the mind, and what it means to their mental health and their spiritual health. And that's not something that's easy to communicate. It just seems to be the way I think for some reason. I'm not even sure how one would teach that. And I don't think it's actually valuable in some circumstances. There are lots of circumstances in medicine where that would be a sideshow, distraction from what needs to be done. Surgeries, emergency medicine. Western medicine has been incredibly effective at acute intervention, and we should all be very, very grateful for how effective they can be at saving lives when lives are in acute danger. But the longer haul issues, kind of solving issues of mind and spirit and how those interact, are a little more problematic. And so communicating that, I'm not really sure. I'm not sure exactly how to say that I try to do that, except to just repeatedly try to show the interaction between layers. definitely one way I try to do that. But I think that the information that we have in medicine about how many different factors are coming together to create health is exploding. We're getting to the point where artificial intelligence is really necessary, probably, to analyze the amount of data that's available. For $100, you can get 1 million single nucleotide polymorphisms analyzed on a given patient now. That might have been $1 million 20 years ago. So we are at the cusp of kind of the beginning of Star Trek medicine. It's really exciting. And so I guess I would encourage everybody to always remember that if you live in the middle in psychiatry, kind of in the realm of mind, always remember to look up and think about spirit, and always remember to look down as well and think about the body, because we as psychiatrists should always be doing our scientific inquiry in our labs and all of that, in addition to thinking about somebody's soul.
And perhaps continuing that theme, so when we're looking at patients who are receiving ketamine-assisted psychiatry or psychotherapy, with folks that are engaging in this type of therapy, how would you best describe how people are able to sort of tap into their consciousness in a different way than they would do in traditional psychotherapy and psychiatry? And perhaps, very much related to that, what would you say is the relationship between the ego and the self?
Well, that is a very fun topic and something I'm particularly interested in. I would take a step back also to a previous position I was taking, which is I do want to clarify that we have a wonderful tradition, a rich tradition of psychotherapeutic modes that we can engage with people in therapy. There are definitely many, many modes of therapy that can be very helpful to patients in different circumstances, and that is an incredible toolbox that psychologists and therapists and psychiatrists learn in their training. And so I'm not implying here that patients can't get the kind of help and attendance to the mind-soul interface. But what is definitely exciting is the power, the kind of effect size that ketamine can bring to that process. I think we have a lot of traditions in therapy that are deeply enriched by the psychedelic assistance in a therapeutic mode. So to be specific, when you're working with a patient in a therapeutic mode, it can be very common for the first 20 minutes or half hour or sometimes even longer to be spent kind of working through the discomfort and defenses to get to the material that is really why they're in the room, what they need to be talking about in that given week, what's happening in their life that needs to be discussed. That half hour of working through the defenses can be maybe helpful. I think that a lot of times maybe there is a process there of working through the defenses that is valuable, but very low doses of ketamine can actually move people directly into the key material and explore the key material in a much richer way. And when I'm talking about that, I'm talking about very low doses of ketamine. Sometimes people might not realize, but ketamine-assisted psychotherapy can be, as a procedural process, can be achieved with very low doses of ketamine, even as low as 5 milligrams. 5 milligrams twice in an hour can be incredibly helpful for moving through the fear and getting to the material and helping people see their way over kind of the hill and to the other side and see that it's, that they can get to where they're trying to get to. The higher doses, what I would say there is that that's kind of a relaxing of the defense structure, the ego defense structure, to allow someone to see maybe what they are guarding against. Higher doses, the kind of dissociative doses we use in treatment of acute depression, these doses will take people much deeper. Defenses basically dissolve. There's a net of inhibitory neurons that seem to control kind of the C plane of thinking neurons called pyramidal cells that seems to kind of be inhibited in that process, allowing the pyramidal cells, all this thinking apparatus, to think more and connect more to different areas of the brain. So there's this kind of recruitment of areas of the brain in terms of the capacity to talk with each other. It's as if almost that every area of the brain is more likely to be able to talk to any other area of the brain when people are under higher kind of or that mid-level dosing of ketamine, the dissociative level that isn't anesthetic but is used again in treatment of depression, kind of the 0.5 to 0.75, even 1 milligram per kilogram dosing over an hour, either as an infusion or multiple doses in an intramuscular delivery. That can be deeply profound for patients to experience, not just the richness of their inner resources, but how quickly and how profoundly they feel that they are essentially okay, that they will be okay, that they are good, that their motives are actually decent and respectable, that they can find kind of a self-love, a self-acceptance that allows them, when they come back into their kind of more defined ego structure, they can see the structures of that interplay. They can see the structures that tell them that no, they can't do that, or no, they shouldn't say that, or they shouldn't be that, or they shouldn't think that, and understand that, well, maybe that's not true, or maybe it is true in this moment, but it's not true as to who I am. It's just true as to what I need to be in this moment. It gives a much richer kind of sense of who somebody is to themselves. And I think at a very kind of core level, it is a realignment of the ego and the self. The deeper aspects of who we are become more accessible to this kind of smaller subset of programming that is designed to get us through our day and to allow us to perform and allow us to do the things that we don't want to do, and hunt for nuts and berries, and put off reward in this moment for larger purposes, to be able to kind of see that goal in front of ourselves and be able to walk the path even when it's difficult.
Following a series of ketamine-assisted therapies, do you find that these people are perhaps more able to tap into some of those realizations, or have their guards lowered down at a time down the track, not induced with ketamine, but as a result of having gone through this process? Or are these sort of altered states of consciousness really integral and perhaps sort of the only way that people are able to tap into those realizations that you're seeing in these assisted therapies?
Yes, that's a question that gets at something that I think is very important in this field that we are aware of and has been characterized, but it's not necessarily understood why it's the case. But there tends to be a sense with ketamine that it's more fleeting, that the information that it gives, the kind of clarity it gives, doesn't necessarily last. And I think there's some truth in that, some real truth. I think that there's something about the inhibition of the inhibitor that means that when the inhibitor comes back online, when this inhibitory neuron net that kind of controls our thinking and stereotypes our thinking and creates a lot of the processes that probably underlie the different networks that exist, the executive network, the salience network, the default mode network, when that comes back online, the fact that it was taking a vacation means that when it returns, it hasn't necessarily fully learned what the rest of the mind learned about itself. It's kind of been absent, and it shows up and says, what's going on here? And tries to reassert its control. That makes sense, really, if you think of what its goal, what its purpose is to bring consciousness within a scope that allows for survival and for kind of meeting our duties and achieving what we set out to achieve. Psychedelics are kind of different in the sense that inner neuron net is very much intact during the experience, and it's basically shown that it is not in control of something that's much larger than itself. At some level, I'm almost, I'm anthropomorphizing neural networks at this point, and it's probably would be embarrassing to speak in this way at a neuroscience conference. But at some level, this is it's a useful way to think about it. That there probably is something different about that interneuron net, that inhibitory net, having to submit to new information, and that the learning that occurs is probably more lasting, and also probably more terrifying in some ways. I think there is a scariness. There's an aspect to that can be difficult. I think that's why ketamine tends to have a gentler nature, because the very structures that actually perceive danger and threat are at some level are the very structures that are kind of taken offline. So that said, I would want to be clear that what I've seen over the years working with patients is that the more work a person puts into understanding and making use of their ketamine experiences, the more they will get out of them. And the work is not always as obvious as it might be with the psychedelics. The psychedelics tend to just directly, I think, explain stuff and what needs to happen and what changes need to occur in a person's life. The ketamine is more mysterious. It's more a symbolic process where some kind of key core symbolism that almost acts as a talisman or a mandala or some kind of thing to turn towards and give direction is offered to the conscious psyche. And if people can capture that symbolism, I do believe they can gain a lot more power out of their experiences. I've seen this directly, and I teach about this. This is something I talk about a lot, is that's one way to leverage the ketamine experience to get more out of it, is to really try to understand what the symbolism that was going on in that kind of dreamscape. It's really, honestly, not that different from a lot of the dream analysis that Jung was exploring, and other practitioners and therapists and theorists in psychology have explored as well. So there's a rich landscape to kind of apply in this process, and we have lots of examples of powerful monomyth symbolism that threads through movies and threads through the stories of our nation and our individual hero's journey and all of that. So there are plenty of places to tap into here, and I would encourage everybody to think in that way. When people don't think in that way, when they don't think of it as something that they need to engage, I do believe that a lot of times the ketamine is very underwhelming in terms of its benefits. I think that I see its effects fade fairly quickly, and it can become a process where someone is just coming in over and over and feeling better for a bit and then kind of falling back into their old state. I don't know exactly what the answers are to shifting someone out of that mode. And I've seen people try to make more out of it and still struggle with falling back into a depressive state or a constricted state after a couple of weeks. So I think that this is early. We don't know all of the factors involved, but I think we're starting to understand at least how the layers are interacting.
Well, Jeff, there are so many more questions that I would love to ask you, but unfortunately the clock has beaten us. So first and foremost, we're going to have to get you back on for the next series of Professionally Psychedelics. But for the time being, I'd like to say thank you so much for joining us on the pod. It's as ever, it's been a fantastic conversation with you.
Thank you, Jonathan. I appreciate your work, and it's been a pleasure to get to know you and join in this process.
Please take me above, take me with you.